Good morning, Commission. For the record, Chuck Henry, Director of Sarasota County Health and Human Services. I'm here for your Sarasota County COVID-19 update. It's been a little while and a little bit of a long journey, and as practice in the past, I just want to start by thanking our community for continuing to stay alert and follow the advice that's put out to protect themselves and our community as we move through this Delta variant surge that we've had this summer. I also want to thank my health department and HHS staff. We're 18 months into this operation, and they continue to do amazing things every day in addition to their what we call blue sky duties to keep everything running. And of course, the county, the leadership at the county, especially emergency management, communications, and HR, and their contributions to our overall effort. I really can't say enough about the work that HR does in terms of keeping our employees safe. They work with all of the county managers to identify individuals who may be ill and need testing and connect them with us. They also help us with contact tracing and providing advice out. And when we're seeing 400 or 500 cases a day, to have that ability within the county system to do that up close and personal contact tracing is really important for our staff. So thank you to all involved. I'll start with our numbers today. These come from CDC. They're yesterday's numbers. I didn't want to try to pull slides together this morning, but you see the CDC has our 7-day positivity rate at 18%. When I calculate it locally, I'm down closer to 15% today. They lag a little bit behind our local data. What's important is that all of the indicators are trending down. I think we've peaked with the Delta variant surge. We've seen it flatten out over the last 2 weeks and begin to drop. That's not to say we need to relax, because what I'm talking about now is daily case numbers going from the near 500 a day down to 400 a day. So we're significantly dropping, but 400 a day is still a lot. If you recall, the end of May, early June, we were at 15 a day countywide. So we have a journey to go to get back down. Our transmission locally is still considered a high level by CDC, so we need to continue to be cautious. Daily case rates are listed at over a 7-day average at 660. My numbers are a little bit lower than that, and that's trending down. Our hospitalization beds occupied is trending down. We were up about 36% at one point. We're down there. We're down to 53% of ICU beds occupied. We were up at almost 60, maybe just a little over 60 at one point. And our vaccine rates continue to climb. Overall, total population, we're at almost 72% vaccinated. Just by note, that's the 4th highest vaccine rate out of 67 counties in Florida, so we're doing really well there. When we look at 18 and above, that's over 80%, and at 65 and above, it's 99%. We still have some work to do in the 30, 40, and 50-year-old range on vaccines, but those numbers are beginning to pick up as well, and I welcome that because vaccines are truly our way forward, not only with this variant, but any potential variants in the future. Speaking of variants, I wanted to cover just a little bit about variants. You've heard me say this before. We expect viruses to mutate and to create variants. That's what they do. It's important to note that so far, all of the variants are being handled by our vaccines. There is, of course, some breakthrough, which occurs with many vaccines if the dose is high enough or the immune system doesn't respond as well. But vaccines have been very successful for either keeping people from getting sick, or if they do get sick, limiting the severity of the illness and preventing hospitalization and death. And so I continue to push vaccines as our way forward, regardless of what variants are out there. It's also important to note that all of our testing mechanisms so far are able to detect all the different variants of COVID-19. So that's also a concern to make sure the tests we're operating will be able to pick up the virus so that we can identify it and treat it. Vaccine distribution efforts continue to push through Sarasota County. At the health department, you can get Pfizer, Moderna, or J&J, all 3 authorized vaccines in the U.S. It's a walk-in basis, 8:30 to 4, Monday through Friday, readily available. We're doing 60 to 100 a day still, which is good, but we'd love to do more. We continue to do pop-up vaccine clinics around the county when the numbers justify it. We try to have 20 or more in a group before we send staff out, because it does become labor intensive to go out and spend a couple hours for a handful of vaccines. We continue to work with churches, not-for-profits, and our medical providers to make sure that we can do events with them or provide vaccine to the providers so they can cover their own patients. And we continue to work with the school district to ensure that we have vaccines available for students. And through, because of the success we had in August, we're now doing a second series of events running through September and into early October on Saturdays, offering clinics at schools at various locations around the county for our students. I want to spend just a second on the third dose. I know this slide has a lot of information on it, but we get a lot of questions about the additional dose or third dose. Right now, the FDA has authorized an additional dose or third dose for those with moderately to severely immune compromised conditions. On the slide here, I've listed some of those conditions. What they're talking about in this group is a very narrow group. It's those that are undergoing cancer treatments for tumors or cancers of the blood, organ transplants, or they're taking medicine that suppresses the immune system, stem cell transplants, or taking medicine that suppresses the immune system, primary immunodeficiency diseases, untreated HIV, and those that are on high steroid dose medications. So that's a pretty narrow group. That said, these doses for that group are available at our health department walk-in basis. They're also available at CVS, Walgreens, all of the outlets out there. You just have to identify to them that you meet one of these conditions, sign a consent form that attests to that fact, and they'll give you the vaccine. We get lots of questions because it's been in the news about everyone else that got Pfizer or Moderna, and there's been some communication from Washington around mid to late September of approving an additional or third dose for everyone. That hasn't happened from the FDA yet, and so as a healthcare provider, the health department as well as all of the other outlets, we have no authorization to administer that dose if you don't meet the current authorized guidelines for moderately to severe immune compromised individuals. Once that happens, so you can watch in the news, I'm hearing lately that Pfizer may get approved as early as 20 September. Moderna is still gathering their data. We do expect that to happen, but we won't be able to give it universally until that approval is given and the CDC's, what we call ACIP committee that puts regulations out on immunizations, gives us the guidelines and the authorization to move forward so that we're not providing vaccines off-label, so to speak. Another busy slide, but I thought it'd be good to put this into the record at your meeting. All of the current testing sites available. We did ramp up testing across our community over the last month as this surge occurred, and we had a tremendous demand for testing. The formal kennel club that's been there all along still continues to operate Monday through Saturday. We have sites at the Robert L. Taylor in North Sarasota and at Dallas White Park down in Northport that are operating Monday through Friday from 9 to 4 and Saturdays from 9 to 1. And then the Ed Smith Stadium is our latest group to come online with support from the Oreos in our community, and they're actually open 7 days a week, 9 to 5. Of note is that the Ed Smith Stadium does PCR only. The other sites offer both rapid tests and PCR tests. I will warn the community that often the rapid tests become unavailable because they run out. There's huge demand across the nation, and so managing the supply chain to get the rapid tests in, which seem to be everyone's favorite, has become a little bit of a challenge. So if they run out, they try to post signs and notify people they're out of those, and they try to get more in as soon as they can to make them available. Just a quick word on monoclonal antibody treatments. Most of you are aware that sites have gone up across our state. The governor has put those out there and is providing those out-of-state assets and partnerships at no cost to citizens that need this treatment. It's a great resource if you're at risk for severe illness, hospitalization, or death. If you become ill with COVID-19, whether you're vaccinated or not, and you have conditions that put you at risk for hospitalization, you should consider getting monoclonal antibody treatment. There's a center at Manatee Memorial in downtown Bradenton in their old emergency room area, and there's one at Tranquilli Park in Charlotte County, which is in the Inglewood area, just south of us, so we've got easy access north and south. It's easy to find them, and it's easy to find appointments. You can go on the website at floridahealthcovid19.gov, and it will bring up a dashboard that lets you look for sites across the state. You can click on another button to get more information. You can click on a button to schedule appointments. We're trying to make it as easy as possible. This is not a replacement for vaccines. Vaccines remain our number one defense against this virus. If you think of the old food pyramids and where we get the biggest benefit for the dollar, vaccines are at the base of that pyramid. So that everybody getting vaccines helps prevent illness in the first place and limits the severity of the illness and hospitalizations. Once you get ill, whether you're vaccinated or not, we need to treat that illness. We want to try to keep you out of the hospital, and that's where monoclonal antibodies can come in. If your illness is more severe or you have risk factors, then we recommend you do that because it will likely prevent hospitalization or even death if you get to it. The one thing to remember about monoclonal antibodies, they're ready-made antibodies that are injected either subcutaneously, which means under the skin, or intravenously, and they go to work immediately attacking the virus, specifically the spike proteins in the virus. And they circulate in your system for a week or two and provide an assistance to the internal battle going on with the virus and boost your immune system. Again, it doesn't provide long-lasting antibodies, so we still recommend vaccines. The one caveat there is that if you receive monoclonal antibody treatment and you've not been vaccinated, you must wait 90 days before you get the vaccine. That's just the way the vaccine labels work. Finally, my key messages, and then I'll stop for questions. They haven't changed a whole lot. I continue to push the fact that vaccines work. They make the biggest difference in our community. We expect them to continue to do very well. And it's really important to note, I said it earlier, that as more variants arrive across the world, and you're already hearing news about the MU virus and other mutations, and there'll be more, as long as vaccines continue to work, they will continue to keep our community safe. And so our best bet is to get everybody vaccinated and limit the amount of impact the virus can have no matter what the variant is on our community. Testing resources continue to be available, not only those that I showed you on the slide open to the public, but we also work directly with the school board and operate in partnership with them. Test sites specifically open to students and parents so that we can try to expedite their testing through and keep them in school. We continue to encourage social distancing and wearing of masks when you're in public crowds, and over the Labor Day weekend, CDC updated their guidance to kind of match what we've been saying for quite a while, that even if vaccinated, not only inside, but if you're in a big crowd outside and you can't social distance, you might want to consider masking because the variants do spread much more rapidly than the original alpha virus. And then, of course, we continue to push hand washing and staying home when you're sick. Being personally responsible for you and your family to make sure we're doing the right things is critically important for our community. That's all I have for you today. Happy to answer questions if you have
Commissioner
them.
Kutzinger.
Yeah, Chuck, thank you for that. Appreciate the great work you and your staff are doing. I understand the monoclonal antibodies treatment, the sooner that you get that, once you get symptoms, the better. Is that correct? I hear that it should be done within the first few days to be most effective.
That's absolutely correct. In fact, if you're more than 10 days into your illness, it's likely they won't put you on it because the effectiveness begins to go away the longer you're sick. So yes, if the important thing is if you have risk factors for severe illness or your illness seems particularly severe, the earlier you get in, the better.
And for the third shot, if that's approved, would you expect a sudden increase in people trying to get that shot? And are you considering doing some additional clinics like we did originally to get the shot out there? Or just people are going to have to come to the health clinic? Or what's your thoughts about when that third shot does get approved, how we get that out to the community.
So at this point, we're not planning to go back to like a big mall site as we had in the initial. And part of the reason for that is vaccines are much more widely available now than they were then, and they're available at many more outlets. So one of the things we're doing is we're already beginning to gather stock and to notify, working with the medical society, providers across the community that we have vaccines available in smaller amounts, because if they try to direct order it, they have to get, there's certain limits, like on Pfizer, it's either 540 or 1,180 at a time, and you have cold chain requirements. So we have a -80 freezer now at the health department for Pfizer. We have plenty of Moderna, probably over 30,000 doses in the freezer, and it's our intention to make that available to providers. They have to be registered in Florida Shots so we can transfer the vaccine, but there's many providers that already did that. So strategy one will be to get it out to as many outlets as we can to help us distribute it. Strategy two will be to expand our clinic hours at the health department for those that want to come there. And then if we find the demand exceeds that capability, we can expand to other levels as well.
Commissioner Ziegler.
Chuck, appreciate that. How do we get one of those, the monoclonal, sites? How do we get one in Sarasota? Is there anything we can do to help push that?
Well, I think if we wanted to identify a space, the state went out looking for 6,000 to 10,000 square feet of available space to put one in. And as that process was going on, one was identified in Manatee and one in North Charlotte. So we didn't push hard to add an additional one here. As you look at the map of them around the state, I think there's about 14, and so we're fairly well covered, having one adjacent to our county, north and south. It's my understanding it's pretty easy to get in for appointments. The first week they were open, they had a lot of demand, but I understand now, as long as you have a positive test and a doctor's recommendation, they'll get you right in and within a few days and get you treated. In addition to that, there's a number of outlets, Sarasota Memorial and other health entities also offer them, just at a lower volume. Sarasota Memorial, at their sites, I think they do at two different sites 15 to 20 treatments a day. These large state sites do 300 to 400 a day.
I mean, I guess from my perspective, we have a lot of focus on testing locations, which is good. You put up that slide, that was good, and that's important to people, but the treatment's a lot more important than probably finding out if you have it or not, is being able to have access to the treatment. So, if you're saying we're covered, I'll take your word at it, I guess, but whatever we can do to increase the coverage and increase the access, because as Commissioner Cutzinger mentioned, it's something you need to do within a couple days of, and some people may not, the distance may discourage them. So if we can get something in Sarasota County, I'd be all for that. Question for you, I get a couple questions and a couple dialogues that come to me, and I just want to clear a couple things up. The testing, now, are we testing a lot more than we were before, or what's the testing level right now?
Our average test over the last couple of weeks has been between 3,000 and 4,000 total tests a day across the community. Sometimes that's, day by day, sometimes it could be lower, sometimes higher. I think the max we've seen is about 5,000 in one day. We've been as low as 1,400 in one day over a weekend when people aren't testing as much or when there's not as much access. So we watch those and try to look at what the demand is. We do have the ability to open up additional testing if we think the demand calls for it. So we do monitor that closely.
But how does that compare to like earlier, this year, right? And last year, give me some perspective.
It's close to our previous peak, which was in the January, February time period. And at that time period, we were averaging between 2,500 and 3,000 tests a day, and we had a few peaks of over 4,000 a day. So it's very similar to that.
Now, the testing, give me some context on that or some color on that. Before, it seemed like a lot more people were just going to get tested because initially at the beginning there was a lot of, fear and people just didn't know what this was, right? So employers forced people to test a lot more, I feel like, early on. Maybe I'm wrong. But then also people just in general were going by and, I mean, I had friends that would go get tested every, week almost, that felt like. It doesn't seem like that really happens. I mean, are you seeing healthier people that are getting tested a lot, or is it just limited to people that feel like they have symptoms, or, I mean, is there any context with that?
Well, I think we have seen more ill individuals getting tested. That's why the positivity rate jumped up to 18%. We were down at 2% at the end of May. So that's an indication that there's more sick people testing, and we're testing larger volumes, but we're seeing greater numbers of individuals ill. I do hear anecdotally from the labs that operate these sites for us, they see a significant percentage of individuals testing to travel, which is okay, the resource is there, but they see also still pretty high numbers of individuals that are sick, especially those in the under 40 group and children that aren't yet eligible for vaccines.
So that's what's tough is like, the positivity rate, it's all relative based on who's getting tested or what the motive is to get tested, right? So if you have more people that are getting tested just because they have symptoms, that's going to raise that rate up rather than if you have just a bunch of the population, everyone getting tested, and then that waters the rate down a little bit, right? So
That's correct.
Yeah, so it's tough. So how do you use the percentage positive as a true indicator or comparison to stuff in the past?
So as a standalone, I can't. I use the percent positivity and the case rate together. And that's the number of cases per 100,000, which gives me a standardized number. And I watch those numbers as they climb or drop. And when I see them both the percent positivity and the case rate dropping consistently for at least a week, then I'm ready to say publicly, I think we peaked and we're moving down, which is where we're at now.
But you have the school district, for example, using 10% or 12% or whatever number they
I think
landed
they
on.
picked 8%. I can't tell you where that came
8%. So
from.
they're waiting for the positivity to get under 8% before they take the mask off the kids, right? So I guess the question I have is that a fair indicator to use? I mean, they're just looking at that number, and that's just going to give you a snapshot based on who's tested, not necessarily the community.
So the positivity rate is, as we said, one indicator. If I go by CDC guidelines, they have the low transmission, moderate, substantial, and high. Our community is still in a high transmission level. And even when we were averaging only 15 cases a day and had a 2% positivity, we were still in the moderate transmission rate. We hadn't moved into the low. We were very close to low. So it's hard to say where is the right place, and I think the challenge that not only our community but across the nation is facing is how do we craft the best way to operate business as normal, keep kids in school, and yet control the virus in a way that we reduce hospitalizations and negative outcomes and still achieve the educational goals or the business goals we're trying to reach. I don't know that anybody has the right answer. There's a lot of different things going on all over, and we have to remember this is a new virus. We're only 2 years into experience with this virus.
But see, that's where the frustration that I have as a policymaker is when you're looking at these. What indicators do you really use to measure success or measure failure and measure concern or measure the need for action? And for something being thrown out like 8% or 10% or whatever it is, I mean, it just, who picked that number? Did you pick that number or did they pick that number?
We did not pick that number.
Okay.
If the health department were to pick a number, we'd probably stick with CDC guidelines and ask for much lower things before they relax protective measures. We look at things through the public health lens, and we want to see as little transmission as possible. And we know that right now in our school system in Sarasota County, they're accounting for about 30% of our positive cases every day. Many of those are children that aren't eligible for vaccines yet. So whatever we can do to help that spread, because the kids get it, they take it home to family members, and that's what keeps things bubbling in our community. In fact, I have two focuses right now, especially when we had our case rates up about 500 a day. If you imagine my staff, we've augmented significantly, that's 500 contacts they try to make every day, which is a 30-minute interview. That becomes almost impossible in itself. And then each of those cases has 5 to 10 contacts that we're then trying to call every day. And so we begin to prioritize who do we need to call first. Our school-aged children and their families is our number one priority, followed immediately next by our elder care, elders that are in residential care, so ALFs and skilled nursing. So I have an EPI team that focuses just on our elder care and an EPI team that focuses just on our school, and then other general staff to try to work everybody else.
Thank you.
Thank you. Okay, well, Chuck, thank you very much, as always, and tell your staff thank you, because they just really did a great job for us right up until today, so thank you.
Thank you.
And,
Lots of work still to do.
Yes, you do. And I would just put into our record, because regardless of what Commissioner Dietert says, we have hundreds of thousands of people who watch us here. When you hear a positivity rate, it is not, that percentage number is not of our entire 435,000 people. It is the percentage of the people who were tested that turned out to test positive.